How can you tell if your pain in sports or exercise is normal or it's worrisome? Let's talk about that. Every day that I'm in clinic in my office, I see a number of new patients, and it never fails that I'll get one or two on any particular day. And when I ask, how long their shoulder or their knee or whatever it is has been hurting, they'll give me answers like, I've been hurting for a year, or I've been hurting for 2 years. And I'm always surprised by that. I'm thinking, how did you let it go so long before you get it checked out? And they always give me some response like this, something to the effect of, well, after it started hurting, I stopped what I was doing for a little while, thinking that that would get it better. And eventually I realized it just wasn't getting better. So let's talk about when pain might potentially be a sign of a serious problem. I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. I provide education, insight, commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform at your peak. This idea of pain, a lot of this comes from the high school football, but you hear this all the time, no pain, no gain. I get that from the sense of, you've got to have some discomfort to really get growth. When you're lifting weights in the gym and you're sore after, that's potentially a good thing because your muscles are going to heal, they're going to respond to that and potentially get bigger. So, sometimes soreness is a good thing. But some bone and joint pain, some muscle pain and things like that isn't a good thing. And how can you know what's good pain and what's not? What pain is something that represents an injury that you might be worse by pushing through it, because we don't want to create a serious injury. And it's hard for somebody that without medical knowledge to know. And unfortunately, I can't give you a very straightforward rule. This idea that, well, dull pain, not such a big deal. Sharp pain, a really big deal. That doesn't work because a lot of times it's not true. It's not that black and white. So let's focus on something other than pain for a few minutes. Let's talk about swelling and what we call mechanical symptoms. And I promise I'll explain what that means. Swelling is the first thing I'd look for. After you do a long training session, it's not surprising you might have a little bit of swelling. You look in the mirror and maybe it seems a little more swollen. Maybe it's your ankle or your knee or whatever it is. Maybe it's a little more swollen. That's not what we're talking about. I'm talking about a lot of swelling. Your knee's swollen up like a basketball, or your ankle is really, really swollen after you roll it on the side of the curb, the side of the road while you're running. Big amounts of swelling, very large swelling. I would argue that that's never normal. It's not always a specific injury. There's medical problems that can cause significant swelling, but it's never normal. So especially after a specific injury or pain that's developed with sports or with exercise, get that checked out. Now, getting back to the mechanical symptoms, these are symptoms that keep your joint from doing whatever it is it's supposed to do. For example, you might have a meniscus tear that causes your knee to lock on you. And by that I mean the knee, is going through a range of motion, but then as maybe you're coming to full extension with your knee, fully straightening your knee, it gets stuck and won't fully straighten out. Or maybe it catches where it feels like it's about to lock, but then you can twist your knee and get past it and have full range of motion. Meniscus tears, loose bodies, things like that can cause locking and catching, probably something worth checking out. If your knee's buckling or giving way, where the tibia shifts out from under the femur, the shin bone shifts out from under the under the thigh bone after a traumatic event, that's potentially worrisome. Another thing to get checked out. Maybe you're a baseball pitcher or swimmer and you get this deep, uncomfortable clicking sensation in your shoulder when you're lifting weights. Might be something else, again, worth checking out. Again, I didn't give you hard and fast rules, even though the swelling and the mechanical symptoms like locking, catching, giving way, deep, uncomfortable clicking sensations, worth getting checked out. What I would argue, and we're going to talk about this next week, if you can't do what you want to do, be it work, be it sports or exercise, if you can't do what you want to do as well as you want to do it, it's probably worth getting it checked out. Now, have you had an injury and wondered whether or not you should get it checked out? How did you decide it was serious? Or did you wait and then when you finally got it checked out, you heard, oh, you should have come in sooner because this is potentially bad? Whatever it is, I would love to hear your thoughts. So below this video, share your thoughts, share your ideas, your experience. I would love to read them, and I know viewers all over the world would love to read them, so it might help them understand what they should do. If you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, subscribe to my YouTube channel. Click the button in the upper right corner of the page, and I record a couple of these videos every week, and I'll deliver those directly to you. Thank you so much for watching. I hope this was helpful, and I look forward to seeing you right here next time.